In what's being seen as a boost to the African Union's target to vaccinate 60% of the continent's population by 2022, the World Bank and the AU announced that they're partnering to support the Africa Vaccine Acquisition Task Team's initiative with resources to allow countries to purchase and deploy vaccines for up to 400 million people across Africa. The World Bank financing will be available to support the purchase and deployment of doses secured by the Africa Vaccine Acquisition Task Team. Now, this comes at a critical time with rising COVID-19 cases on the continent. I spoke to Axel van Trotsenburg, who's the World Bank's Group Managing Director of Operations.
We have to correct the inequity that we have been observing to date, that Africa has been left out, which is totally unacceptable. And only 1%, less than 1% of the African population has been fully vaccinated. This is a problem that needs to be corrected, and action is required. And I think, therefore, we welcomed very much the African Union's initiative to take this initiative to acquire vaccines. In this case, 400 million doses from Johnson & Johnson. The advantage of this is it's a one single shot, the dose, so it could benefit up to 400 million people. What was missing is the financing, and then we have been working hard over the last couple of months to have a financing in place for African countries. By the end of this month, we hope to have at least for 30 countries financing in place, but basically all countries qualify. And what we would like to do is to basically what was negotiated by the African Union, that we can finance this. And so this is a very good prospect that on top of the COVAX that aims to provide vaccines for 20% of the African population, that we now can come in together with the African Union to cover up to 30% of the African population. So this is what we are working on. I think that we're working day in and day out. On Monday, we had a great meeting with over 25 ministers of finance, as well as another 10, 15 ministers of health to advance the agenda. I think urgency is right now the name of the game. We need to move fast.
All right, so one of the issues that we've been seeing quite a bit on the continent is sometimes these funds come in, but they don't necessarily end up doing what they're supposed to do. And I wonder how the World Bank is going to make sure that this facilities, these assistance, does what it's supposed to do, and that is to focus on the vaccination programs.
Well, what we did actually since the end of last year, working together with the countries, with African CDC, with the WHO, UNICEF, was to actually do readiness assessment of the countries and identify gaps where we need to make sure that when the vaccines come, that they can be deployed properly. So what we have also offered countries is to provide deployment assistance, financial support, so that indeed that can be done. In addition, what we have been promoting very much is that there is a fair distribution, that particularly those who need to get the vaccines first, get them first. We have been across the world been supporting programs and particularly attacking elite capture, corruption, and promoting that this is done in a transparent fashion.
So how do you do that, though? Do you put in auditors? Do you have people?
That is correct.
Yeah.
We have, and what we are favoring is as much transparency as possible. We had a country, a middle-income country, where we started delivering, and all out of a sudden some of the parliamentarians wanted to be first. And we said we would not finance this program any longer if this is the case. First, you need to respect those who are in desperate need to get them first. And I think the WHO has established very clear criteria how you could distribute that and that it is done fairly. I think this is terribly important when people are suffering, that they would like to know that the distribution is done fairly and properly. And we will work hard on this. And I think with the proper support, I think we can do it.
This vaccination rollout, how quickly will we see it working and actually making a difference on the ground?
So this is coming, we expect the first doses to arrive in August. And I think this is good news that this part is coming. Then there will be doses coming from COVAX. And as you have seen that there were recently some announcements from G7 countries also to provide additional donations. So if this is all coming together, I think we are going to see movement in there. I think this is badly needed because, as I said at the outset, Africa has been left behind and we need to catch up quickly because also there are third waves of infections happening in various African countries. So we need to move fast.
This week, the WHO announced that South Africa will host the continent's first COVID-19 vaccine production facility. And I just wonder what the the World Bank's position is in allowing capacity building for African countries to manufacture its own vaccines going forward.
So we are strongly supportive of this. I think what this pandemic has tragically shown that there is a lack of manufacturing capacity in Africa, and that has to be corrected. As you know, the World Bank Group has also a private sector arm. It's called the International Finance Corporation, and that is working already quite actively with investors in Senegal, Rwanda, as well as in South Africa to deal particularly with the manufacturing issue. It's an important thing. We want to be strongly supportive of this, and not only to take a look at the current COVID pandemic, but also taking a longer-term view how the African continent can have its proper manufacturing capacity to deal with many of the vaccines that have to be distributed over the medium and long term.
The World Bank came in and has been helping African countries with special facilities and special rates during COVID-19, particularly after the first wave. But we're now going into what some people might say a much more difficult period with a third wave. Is there a plan for the WHO, that the World Bank, to assist countries even further? Because it may be what lies ahead is much more difficult than what we've seen and left behind us.
Well, I'm not only looking at further. We have said when the crisis started is that you cannot only look at the health challenges, but you see millions and millions of kids out of schools. You see girls not returning to schools. You see people out of work, and you see that the continent has been badly hit by this crisis economically. So therefore, what we have been doing is to scale up massively our support. In fact, since the outbreak of this crisis over the last 15 months, we have dedicated more than $41 billion of resources to the African continent, and we are committed to continue to do that at these levels. Why? Because I think this is the time of a massive crisis where also massive support is needed. And it is not only in the health area, it is in the also social sector, social protection, as well as to help Africa in its recovery effort. On top of that, Africa has been hit by various crises. Think of the locusts, think of some of the droughts that are affecting the continent. And therefore, I think one has to stand with Africa. The World Bank is doing this by actually shifting its lending program over the last couple of years decisively to Africa. Now 40% of our entire lending volumes go to Africa, and this is to stay.
All right, and perhaps finally, often loans from international institutions come with some pretty strict conditions, and I wonder, during this period of time, is there a relaxation of the norms, or how is it going to work?
The way it is going to, I don't think that a condition is called, when you say it should be transparent and it should not involve corruption, I don't consider that conditionality. We want to have a sharp focus on the people, and that it is a people-centric organization that is sharply focused on poverty and those who are excluded. I don't think that that is too much to demand, that we need to stay focused on those who have been shut out of the development process, denied a chance to succeed, and those we want like to reach, and those we will support with all our heart and money.